right, so this is the informational webinar for the graduate professional and capstone certificates in global health online. My name's Ann Evensen. I'm with the Department of Family Medicine and the faculty director for this certificate program. So I wanted to talk about our Office of Global Health here at the UW School of Medicine and Public Health. So as I mentioned, I'm the faculty director for the certificate program. We also have our director, Dr. Jim Conway, and Dr. Amelia Ianamaikas, who is our programs coordinator. I will stop and let Emmy introduce herself.
My name is Emilia Ianamaikas, and I'm the programs coordinator at the Office of Global Health. And I started in the position in July this year, so I'm pretty new here, but always happy to help and happy to guide the students. Thank you.
So our office is in charge of the graduate professional and capstone certificates, which we'll be talking about today. We also have oversight of all the School of Medicine and Public Health student international clinical and research experiences, as well as our field courses, most of which are in conjunction with the UW Study Abroad office, which we'll be covering as well today. We also have some activity related to policy and procedures for safety with travel. And for that reason, we interface with the UW Risk Management and International Division. So our approach is that global health really takes all of us. There are so many different challenges in the world, and it requires a lot of different types of brains, a lot of different types of approaches. And so we really value our interdisciplinary and multidisciplinary approach in our certificate program. I'd like to stop for a moment and allow people to introduce themselves. All right, so our Global Health Certificate and experiences have been enjoyed by many, many UW students. So from 2005, which is when the certificate program started in an in-person variety, we've had about 1,200 students participate in our faculty-led and independent global health field experiences, and about 320 students have earned the full Global Health Certificate program. Our certificate program started out as an in-person certificate, but has subsequently been transitioned to an online certificate program. And that was done with the UW instructional design team, specifically so that it could be as engaging and meaningful as possible in an online environment. So each separate course within each semester is largely asynchronous. Usually there's one or two synchronous meetings, always virtual in the courses. And that's really because we understand that pharmacy students have different exam schedules than medical students, who have different exam schedules than veterinary students and master's students. So want to make sure that everyone is welcomed. We focus on lots of different types of global health topics, and we really like those that transcend national boundaries, those that focus on health and disease in underserved populations, and those with what we call glocal or global local applications. So for example, things like working with interpreters, and that skill can be useful whether you're working with a patient 3 kilometers away or 3,000 kilometers away. This is just a screenshot from one of our courses. This is from Yanis Tepesa's course 711. And we have routinely received strong marks for our course organization and the way our materials are presented. So this is in the Canvas learning management platform. Each of the weeks of the course have topic summaries, learning objectives, a different kind of engaging materials, which I'll get to in a moment, and it's typically brief assessments. So there's a wide variety of learning materials. So we don't think that just recordings of us talking, like faculty talking, is a very engaging way to learn. So we do have some lectures, but typically they're very short. And then we use a lot of different readings from different sources, podcast types of interviews, and other video like TED Talks and animated videos, current news stories, global reports. We do some individual, and some of the courses have some group work as well, but there are no finals in any of our courses. So why consider having a global health certificate? And we think that it really indicates interest and expertise to future employers or residencies. I've written many letters of recommendation for students who are going on to two different training programs and residencies, and that is a nice way of demonstrating a special type of expertise. It may also help you form a basis for future research, volunteering, or collaborations. Maybe it's just to explore an area of passion or to provide service to others. We want to make sure that our certificate is meaningful, and so we're doing exit surveys and alumni surveys on a regular basis. Our 2025 exit survey, two focus areas were work with resource-constrained communities. So 100% of the respondents felt that they had an improved understanding of working in these communities, and 55% said to a very significant degree. 100% reported increased likelihood of working in these communities. Again, 33% reported a very significant increase. And as far as value of certificate, 100% of respondents felt that it was valuable, 66% responding very valuable. We also asked certificate graduates what they were planning to do with their new information. And you can see there's a range of interests that people are exploring after the certificate. So again, furthering research interests, volunteering, going on to further education, or continuing in their current position or getting a new job. So a wide variety of where they go next. Here's one example from a former capstone certificate student, Natasha Irish. She said, I had the opportunity to network with instructors and UW faculty working in the field. She applied for a position, and this was with Baylor University in Texas, a very strong global health institution. So she applied for that position, and she ended up overseeing the development of global pediatric and maternal health initiatives. She really felt that the certificate set her apart from other candidates. Her interview team was impressed with her skills and strong foundation from the certificate, and she accepted the position and continues in that position to this day. And she has also gone on to earn a PhD in public health as well. So the requirements for our certificate, and we have 5 courses, again, based in that Canvas Learning Management program, and they're 2 credits each, so a total of 10 credits there. 710 is an introduction to global health. 711 is global public health and healthcare systems, so kind of that 30,000-foot view. 712 is infectious disease. One Health, which is the idea that animal, human, and environmental health is interlinked. And 713 is about non-communicable diseases and their determinants of health. 714 is a field experience preparation course. The field experience itself, there are several varieties, which we'll get to in the next few slides. And there's a minimum of 1 credit of field experience to contribute to the overall total of 11 credits. So our field experience options, option number 1 is faculty-led, and we'll review what those options are. Number 2 is an independent option, and number 3 is a no-travel, independent, structured analysis of a global health issue of the student's preference. For all of these options, you need to take that Public Health 714, which is the field experience preparation course first. So those faculty-led field experiences typically are 2 to 3 weeks in length. We have 3 currently. So the trips to Ecuador and Thailand go in May, typically right after finals in the summer. And then the India course goes either at the very end of December or early part of January. The theme for the Ecuador course is the interdependence of human and animal health, culture, and the environment. One of the co-leaders for the Ecuador course is an anthropologist, so he lends a wonderful lens to that course. The Thailand course is led by Dr. Jim Conway, our Director of Global Health and a pediatric infectious disease specialist. His course is focused on public health and infectious diseases. I run the course to India, again, surrounding One Health. We have a unique experience working with a co-leader who is a veterinarian and a wildlife specialist. Option 2 is the independent field experience. That tends to be more research or project focused. It can be done in or outside of the US as long as it's with an underserved community. You'll work closely with both UW and on-site advisors to develop your project. And especially if you're going to be traveling outside the US, it's better to have some international experience since you'll be traveling solo. There's also a faculty-led independent hybrid course in Guatemala that has a service learning component, and we can talk about that more if you're interested in the details there. Option number 3 for field experiences is that no travel option. So it's an in-depth analysis of a global health topic of your choice, and it's really designed to meet your needs and interests. So examples of things that students have done in the recent past, we're looking at barriers to care in South Africa for antiretroviral use, the stigma of mental health care in Iran, and medical tourism from sub-Saharan Africa to India. If you happen to be a PharmD student, please let me know. One of the options for a field experience is an APPE, which is a clinical experience in an international setting, or sometimes in the US with an at-risk population as well. We have a handbook for our certificates, and there's a specific appendix in our handbooks, which I'm happy to share for pharmacy students. And the picture here is of Dr. Mara Kieser with the School of Pharmacy, who is the Director of Global Health there. She would also be closely involved in planning this experience with you. These are some additional images from our Ecuador field experience. These images are from Thailand. These images are from India. And these images are the service learning project in Guatemala. So lots of positive student feedback about the field experiences as well. So some students from Ecuador felt better prepared to work with clients from different cultural backgrounds and professionals from different disciplines. They loved the interdisciplinary aspect of the course and felt it had a profound impact on life and work. Some feedback from India, a real-world opportunity to learn about One Health, human and animal emergency services, and the One Health and interdisciplinary focus of the trip changed my understanding of global health by helping me think outside my realm of expertise. So let's talk about costs. So for the Canvas-based courses, if you're already a full-time UW student, there's no additional tuition. Part-time UW students would be charged per credit at their home department rate. And capstone students, meaning those students who are not actively involved in a degree-seeking program at the UW, those students are charged $800 per credit. The cost for the field courses really depend on the choices that you make. So for the faculty-led courses, there's the flight cost, and then the UW Study Abroad fee, which includes the tuition. And those program fees, I'll show you how to get to those in a little bit. And then the independent study and the no travel, which tends to be about 1 credit. So those are often listed as like course 699s for medical students, Med 910, or the public health 715. Those would involve costs based on, again, what you choose to do. The no travel experience would just be the tuition if you're not already a full-time UW student. But for example, if you chose to travel outside the US, that could be a more expensive plane ticket. As far as financial support for the field courses, students are eligible to increase their financial aid allotments for credit-bearing global health work, and this would count. And then our UW Study Abroad program, which is called International Academic Programs, has a unique set of scholarships specifically for graduate and professional students who are planning to attend the faculty-led field courses. So that would include Ecuador, Thailand, and India. And depending on the school that you're enrolled in, the school-specific funding may also be there for you. So to summarize, the certificate is involving engaging instructors and students from health and non-health disciplines from UW campus and beyond. The graduate and professional certificate is earned during the primary degree. So for example, during your MD or PharmD program. The capstone program is earned while you're not enrolled at the UW in another degree program. Both the graduate professional and the capstone certificates have the identical curricula, so 5 courses, 2 credits each, designed with UW instructional design team members for meaningful asynchronous learning. And then that field experience, at least 1 credit, there's those 3 options: faculty-led, independent, or the no travel in-depth analysis. So next steps. The applications for the field experiences that are coming up in summer 2026, the applications are due December 5th. So that includes Thailand, Ecuador, and Guatemala. And then for the India program that would be happening the following winter, so leaving December 2026 or January 2027, those applications will be due at the end of August 2026. We just had a field course information session in person, and that was recorded, and that's now on our Office of Global Health website. Our next info session will be October 2026 in person, but again, encourage you to look at the recorded one that's on our website. And then as far as applying for the certificate, as opposed to the field experience, we take applications year round. We have a rolling acceptance. So here's some QR codes to get you where you need to go. So OGH stands for Office of Global Health, .med.wisc.edu. And we've got our QR codes for the recorded information session that I was just mentioning, as well as the Global Health Certificate website. And these slides will be shared with anyone who is registered for the program today. So you'll be able to capture these if you don't have your phone available to capture it right now. And here's some additional contact information for Dr. Conway, myself, and Emmy.